turn it over to Liz Murray, for in terms of gathering, we've gathered, the experts from health, microfinance, development finance, and the philanthropic areas in this conversation to really create a sustainable model to scale programs, for women. Dr. Huma spoke about the female healthcare worker, so did Dr. Ashu and Osman. What do you see as success in terms of what we've been talking about, and what outcomes do you think we should track to ensure maximum impact?
Thank you so much again for having me here, and I'm very optimistic with everything that I'm hearing, and good to see friends back gathered, hopefully in person very soon, and not always via Zoom. It has its advantages, though. You don't have to worry about the long drive into the meeting or the flight, but we need to see each other again. That's a big question, Joanne, right? I mean, the first thing is we have a lot of experience with being able to deliver and partner for successful outcomes in health. And they vary, depends on what situation, right? Elimination programs in Egypt. We've worked very strongly with our partner in Pakistan, delivering outcomes towards cure. And we have examples across, for sure, our 127 countries and across the world as a Gilead. Some of the things that we need to make sure are in place before we can even embark on such I love Dr. Huma, revolution. This would require, an outcome would be that we could revolutionize. And some of the key components are you have to have commitment. And I've heard here and I've seen and understand the commitment here to make something spectacular happen in Pakistan. We have to have knowledge of the problem and the barriers. And we've already heard from all the experts here. We have a good understanding there. And we have to have some type of system in place where we can then impact better. And so we have 100,000 lady healthcare workers in Pakistan, but they need help. And they shouldn't be working for free. And as a woman, I'm excited to know that I'm part of this asset category now. I'm going to be leveraging that. So our next call to Harold, we'll be talking a lot about this asset category. I think it's important. I mean, you hear, Phyllis talked about it, and Osman, Colin talked about it. I mean, the return on investment with this group, female workers, is huge. And so I think we have the opportunity to really improve their knowledge, improve their understanding of what it means to be an entrepreneur, make sure that they get paid for the work that they do, and help them identify specifically what are the health needs, where can they focus so that we can bring primary care to the forefront. And because tertiary care system it doesn't work and it's not available for all. So that's how we would measure it. How many and how can we improve and measure access? How many people are coming in to get care, and how are we improving those outcomes? Are kids going to school more? I loved some of the measurements that Phyllis shared with us earlier. Are they going to school? Are they thriving? Are the numbers of, infant mortality, and Osman shared some of those data points of children not being able to thrive. So measure it there. We should have, and we need to measure the outcomes. And that's where we can assure our investors that it's a worthwhile investment.